right. Hello, everyone. Welcome to Fusion Academy's community education event. My name is Mackenzie Douglas, and I'm the Director of Admissions and Outreach for Fusion Academy Scottsdale. In case you aren't familiar with Fusion Academy, we are an alternative accredited private school serving grades 6 through 12. Fusion is a revolutionary community of learning where all classrooms are taught one-to-one, one student, one teacher. This unique relationship-based education allows us to meet each student where they are at, create a meaningful connection, and find the very best way to unlock each student's passion for learning. We offer in-person classes, live online classes, and tutoring support for students. And a few housekeeping matters before we get started. If you haven't already, please mute your line so we can hear our speaker clearly. And if you have a question that comes up throughout the presentation, you can either hold that and have that question answered at the end of the session, or you can drop it in the chat and we will bring that question up during our Q&A section after the presentation. And today we have the pleasure of learning from Dr. Paula McCall on the important topic of mental health in a pandemic, how to help our children survive and thrive. Dr. Paula McCall is an Arizona licensed psychologist and nationally certified school psychologist who specializes in working with children and adolescents in her private practice, Next Step Psychology. She received her PhD in educational psychology from Arizona State University and serves as an adjunct professor for the University of Arizona. Thank you so much for being with us today, Dr. McCall.
Hi, thank you for having me. Yeah, we have so many things to consider within the COVID pandemic. So I appreciate the opportunity to just kind of go over some things, talking a little bit about how this is affecting our children, and it's also affecting us as well, and what that may look like and what we can do to offer support to our children. So I do have a few slides I'm going to go through. I think it's helpful to kind of have that. And of course, then you can take any screenshots or anything like that along the way for some of the information. But really, some things to consider with COVID is that there's been so many areas that have impacted. And actually, this list came from I asked a number of my clients about what the impact has been on them, and even my own children. So these are a list. This is information that has come directly from the youth who we are working with and concerned about. There's been this real tremendous sense of loss of connection, obviously for all of us, and what connection means has even changed, and how we connect with people. We see our children losing participation in what we might consider like rites of passage, high school graduations, the transition from middle school to high school, birthday parties, significant birthdays, those 16, and all of those. So we see this loss of things that we're supposed to have in our lives and that we're not able to access right now. Lots of feelings of social isolation. And then we have this challenge also with coping strategies. We all have coping strategies that we use, whether adaptive or maladaptive. We do all have coping strategies. And what we're finding through COVID is that we don't have access to our previously used coping strategies, to many of them, because a lot of them involve maybe going out or connecting with friends in person and things like that. And so we've seen reduced access to some of those things, which also means that, especially with our youth, they're overusing the coping strategies that remain. So when we have a coping strategy maybe has been using electronics, playing video games, something like that, but maybe it was balanced by other things. And now we see that overuse. And so then when we're using something too much as the answer for everything, there's less effectiveness. So we're really seeing our youth struggling with coping, especially as things are going on and we keep passing all these points where we thought things would get back to normal. And we passed multiple points of that. And now we're seeing numbers even rise even more now, and really just not knowing what to do and how to manage that. We also see this challenge with extended time with dysfunctional family dynamics. And I would say that every family has some level of dysfunctional dynamic that might come out at certain areas, some more than others. But we see this extended time together as really bringing out whatever those are and magnifying them. And it's so much harder to resolve those when we can't take the break from it. So we're definitely seeing that piece as well. We also see a lack of boundaries between settings when parents are working from home and living at home, and children are schooling from home and living at home, and anything recreational is at home. There's not any boundaries there about what is defined where, and that's becoming very challenging, very confusing. I think in many situations, parents are even more involved than they may have traditionally been, because they kind of are taking on this additional role as co-teacher in some ways, and following up more, and it's creating a lot of tension and stress for our children who are not used to that. And then we have this whole additional stress. This last one actually came from my 8-year-old daughter when I asked her, what's the biggest impact of COVID? And she's like, we always have to be aware of it. We always have to think, we always have to clean things. We always have to, it's just always this weight. It's just always present. And it was really significant to hear even from that young, that of course we are all feeling this weight on us. So what does that mean to our youth? So we have critical resiliency factors for children and adolescents, especially. There's many resiliency factors, and resiliency is basically the belief that I can get through difficult things and being able to do so. So it's all those things that impact that development of that belief and being able to actually get through difficult times. So there's lots of different resiliency factors out there, having friendships, having problem solving skills, having coping strategies. Like, these are all resiliency factors. There's this trio of resiliency factors that are really showing to be critical for our youth. And in seeing them, we can also say on each one of them, check, 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 COVID has hurt that. So one of our biggest things for our youth is having connections to adults who they truly believe care other than their parents. And what we see now is that, there's a lot less access to coaches, to things like that, and even to teachers, to other people around, sometimes in churches and environments, that even when we're still participating in these other situations with these other adults where we have these meaningful connections, our connections are impaired because we're amassed and 6 feet apart, and it's not the same kind of connection that we would feel otherwise. Another critical resiliency factor is feeling a sense of belonging. And I often ask the clients I work with, the kids I work with, where is that place that you would be missed if you weren't there? And many times we don't have that to begin with, and that's an area to build. But our youth who have had that have lost a sense of belonging through many activities. I think especially of my clients who have been in theater, and that's been their place where they belong. And theater is not happening. Or if it is, it's very different from what it used to be. And, just other areas where we just felt like we belonged, again, like the churches and just even our friendship groups, all of that has been altered. And then another critical resiliency factor is this giving to others is coming up more and more, like through volunteer work and things like that, that this is really beneficial for our youth, especially. And part of that is because one of the most harmful things that we can feel is feeling like we're a burden, that that we just don't contribute anything, and we're a burden on our parents and a burden on our friends and things like that. And we often find that in suicidal thinking, that this feeling of burdensomeness. And giving to others directly counters that, because you can't be a burden if you're giving to someone and helping someone feel better. But our opportunities to do that are also much more restricted and reduced than they would be even on a day-to-day basis, just connecting with people and being kind to others. And we also see with our general social climate that there's a lot more tension and stuff too. So it's challenging. So these areas have been directly affected through COVID, and that's because we're in the sense of this ongoing crisis. Now, it's important to really conceptualize our experiences and our children's experiences in COVID right now as an ongoing, prolonged crisis. We are all in crisis. And we are learning we have adapted to being in crisis, but our level of calm and resolve, whatever it was before pandemic, has risen for everyone. And now our new normal is this constant elevation. In crisis, a crisis is defined by feeling powerless and feeling like you don't have control, and feeling like things are out of your hands and you don't know what to do. And it seems like that's coming up all the time. I feel like myself, almost every day I'm encountering another decision related to COVID that I would never have had to consider before. And how do I figure out what the right answer is? And there is no right answer. Um, and so we're dealing with that constantly, but feeling powerless and feeling like we don't have control, those are important pieces to recognize are happening in a crisis, because those are also areas that we want to target. How do we find our power? Where do we find our control? I can't make COVID go away, but what can I do within my own realm, within my own power, in my own little household? What can I do to feel that I have some control and that I have some power in the situation? Crisis results in feelings of helplessness and hopelessness. And we especially have that right now with COVID, because we just don't know when this is going to end. I think in some sense, many of us have even shifted that idea. When will this end to when will this change? Is this really almost this feeling like, this isn't going to end? And whether or not that's accurate, I feel like we're kind of shifting to that. And that's saddening. I feel really helpless about that. I feel hopeless about that. And then that also impacts helplessness, and hopelessness are direct symptoms of depression. And so we start also seeing, higher depression experiences among ourselves as well as our children. And then, of course, we also have anxiety, because we are living in a constant threat. And when we are when we are experiencing a threat, it is our brain and our body's reaction to have anxiety to help prepare us and prevent us from getting harmed. Our brains are working the way they're supposed to. In a threat like this, in a threat of COVID, we should be having higher anxiety because we need to be more vigilant. The problem is that with COVID, this is so prolonged that that higher level of anxiety is becoming our normal. So it's important to keep in mind here that we are all experiencing this continuous state of stress, and the anxiety has elevated with all of that. Now, with anxiety comes all kinds of physical symptoms. Our body responds to anxiety is a physical response as well as a cognitive response. So it does things like our muscles might get tense because our body is preparing to freeze if we need to, or to run if we need to. Our digestive system shuts down to make sure that we have enough energy to put to if we have to run, if we have to flee, because that's our brain doesn't understand that COVID, we're not going to run away from COVID. It just knows that we're in a threatening situation. So these things happen. And so then we have a lot of physical symptoms related to anxiety, things like muscle tension, stomach aches, loss of appetite. We have all these things, and we're hearing more and more of those symptoms being reported by our children, especially, who don't understand where it's coming from. I didn't used to have stomach aches like this. What's wrong with me? Actually, nothing's wrong with you. Your body is actually responding the way it's supposed to be in a state of chronic stress and threat. But we need to find a way to help you teach your body that it's okay. You got this under control. Thank you. Thank you for helping me out, but it's okay. I got this under control. Anxiety also targets the future. As far as the cognitive part of anxiety, the thinking part of anxiety is all about the future. What's going to happen? I hope this doesn't happen. I hope I don't get sick. I hope my parents don't get sick. I hope that I can still get to, meet with my friends and we don't get quarantined. And, all these things. Anxiety is about the future. And right now, I think more than ever, I know in my life, the future is so unknown. I don't even know what's going to happen tomorrow. Right now, are we going to shut down again? I don't even know. So it's that anxiety really targets that as well. So it's hard for us to calm the brain response that's giving us all of these things to be concerned about. And then, as mentioned before, our previously utilized coping strategies are being overused or are no longer accessible. And so we start to feel more helpless, more hopeless, which is resulting in depressive symptoms. So we see this increase in anxiety and depression among our youth, and not just our youth, among us as adults as well. That the rates of anxiety and depression are rising, and it makes sense for that. So what does that mean? It means that we're going to see more symptoms of anxiety and depression in our children. And we're going to see things like maybe more mood swings, or challenges with eating or sleeping, or more persistent worries, complaints of body aches, things like that, wanting to be more isolated, locking himself up in their room more often. And it's hard in the COVID world to determine what's normal and what's not. At what point is my teenager locking himself up in his room, again, a point of concern, and versus just being a teenager? And at what point am I concerned about my child's lower grades, for example? And I have many discussions about this. Our expectations pre-COVID are not fair expectations for any of us now. That the expectation, well, you've always been an A student. Why do you have B's and C's now? That's not a fair comparison, because it was a completely different world and environment when I had all A's. And those B's and C's might be me working even harder than I ever did before. We have so we really have to be careful with adjusting our expectations and recognizing that we're in a different situation. And that goes for us as well. We're still holding ourselves to these high level expectations. I used to be able to get all this done. I know for me, I used to be able to get my reports done in 2 weeks, and now it's taking me 4 or 5 weeks. And I've just had to adjust. Like, that is just the way it's working. And that is just the reality. And that's okay. So, but we do have certain areas that we want to be really aware of with our youth, that where they're not able to re-engage. They're not able to come back to regulation when they get emotionally upset. Can they bring themselves back down? Are they still responsive to us? Are they still connecting with friends in whatever way that they're able to? We want to make sure that some of those things are still intact, because what we're really concerned at this point is about self-harm and suicide. And the self-harm is a coping strategy. It's not a very adaptive coping strategy, because it creates new problems, but it is used as a coping strategy. Not sure what else to use, not sure what else to do. Well, a lot of our youth are getting to that point where they don't know what else to do, that they may be engaging in self-harm and also substance use. And we see that definitely in adults, that the use of alcohol has skyrocketed since COVID. So because we don't know how to cope with it all either. So same thing with our children, is that they can be turning to substances and as well. So some important things to be aware of in thinking about self-harm or substance use is just being really aware of certain signs, like that increased secrecy, that you just get a sense. And as a parent, you get that sense. Something's off with your child, something's different. And I really encourage parents to pay attention to that voice that says something's different, and to have direct conversations with their children when they hear that voice. I'll talk a little bit more about those direct conversations in a minute. Also, another thing to watch out for is this increased agitation when there's questions. Like, hey, where did those scratches come from? You know what? You're always in my business. I don't know why you're always in, that defensiveness, that increased agitation. That often means that there's something more to the story. We also see with self-harm, especially, some really weird stories sometimes that come out, like, oh, shoot, they saw this, like, they don't think ahead necessarily. Some do, but like, oh, well, I was playing with the cat and he scratched my arm. I was like, you never play with the cat. Like, you see some of these weird explanations, and our parent voice starts speaking up to us and saying, that's not right, something's not right. But it's scary to confront some of those things, especially when that's unknown as well, and you don't know what you're walking into. And so it's easy to block that voice out. But again, we have to listen to that voice. Touching a moment on suicide, is that we are seeing increased rates. There's not a lot of information out there right now about what we're seeing during COVID, but we are seeing increased rates of suicidal ideation, suicidal thinking. Not quite sure if we're seeing increased rates of actual attempts. Not quite sure why that discrepancy is there. Maybe just because we're looking at a short-term period, and that there's still kind of the sense of hope for things will be resolved, things will get better. I still hear a lot from my clients, when I see my friends again, those kind of, like, there's still a sense of hope there. But because we're experiencing all these other challenges going on, and especially with the coping strategies not being as effective, that we see some people spiraling more into that more significant, serious depression and not being able to get back out. So I wanted to just touch upon some of the key warning signs of suicide, and there's many, and the more that there are, the more concerning it is. There can be things that are not on this list for sure. Sometimes people will not show any of these things on the list. So suicide is unpredictable. And many, there's no way, there's no diagnostic way to predict that someone is going to. All we can do is look in the moment and see where that person is at right now and what we can do to provide them with support. So, but some of the things talking about and making plans for suicide is a huge warning sign of suicide. That sounds pretty obvious, but what do we often do? They don't really mean it. They're just looking for attention. Well, that's not even a healthy way to look for attention. So even if that's the case, it still needs to be addressed. But again, it's that I don't know how to deal with this. As scary. I don't want to believe this is true. So I will write it off. But it's so important if we hear any comments about suicide, or that we see posts about suicide or something along those lines, that we do address it. Hopelessness about the future. It's tricky because we do have some sense of hopelessness about the future right now, especially as COVID persists. But still, if we're hearing that, especially more long term, like, I'm never going to get into college. I'm not going to, like, I'm never going to have a family. Like, what's the point of all this? Like, just this sense of ongoing hopelessness about the future. Another big area of concern is severe, overwhelming emotional pain or distress. And some of us have experienced this level of emotional intensity, some of us have not. And so it's really hard a lot of times to understand where that is and what that is. But it's literally painful. It hurts. And it hurts so much. And it is not easy to get up out of bed. It is one of the most difficult, painful things to get out of bed, sometimes in the severe, crippling cases of depression. And that's a very real feeling and experience. And when we're hearing from our children that they're so sad, or they're just sobbing and they can't, or they feel so numb that they, can't feel anything on the other end of things. Anytime we see or hear that, we really need to be concerned, because there's not a lot of coping, especially what's available right now, that's going to make that feel better. So we definitely see that on a cycle towards more of a high risk of suicide. Any marked changes in behavior. And again, this is the parent voice speaking to us, saying something's different, something's wrong, something changed, they're acting funny, they didn't used to do this, they didn't used to do that. They used to be happier, they used to talk to their friends more. Now that's difficult in COVID, because what are we comparing to is pre-COVID, but we even see this within the pandemic, that we might see some changes. I have a number of clients who were pretty optimistic early on, and then something happened with the new school year, where it was supposed to be fixed by now. And then they start disconnecting, and we start seeing some changes in behavior. It's really important to, if you hear yourself saying those things or thinking those things, or hear it from someone else that they used to and they're not that way anymore, that you see the smart change, that is a significant possible warning sign of suicide or suicidal thinking. Always important to note too that can go the other. It doesn't necessarily mean a change to the negative. It can also mean that, they were really overwhelmed, and they were, talking about suicide, or they were really depressed and withdrawn. And now all of a sudden they're like in a great mood, and they're feeling good. So good. The storm has passed. Everything just changed. The sun came out and they're a better place. That is one of the most significant warning signs of suicide. Is that marked change from that significant depressive place to appearing to be happy and content. And that being a marked change, not a gradual change over time. But because oftentimes that signifies that there has been a plan put in place, and that they know they've made a decision to die by suicide. And so there's almost a sense of relief from that, because that has been determined and made. So we have to be really careful about those marked changes as well. I mentioned the feeling of being a burden and how significant that is. If you tie feelings of being a burden along with feelings of hopelessness about the future, that's a pretty challenging combination, where I feel like I'm no good to the people who I love in my life, that I'm a burden to them, and nothing's going to get better. So it's just a perfect combination for suicidal thinking, because where else would you go with that? Insomnia is something persistent insomnia, and we see not necessarily insomnia of my kids stayed up all night playing video games, but like that they can't sleep. And that insomnia is often found, chronic insomnia is often found right in the days leading up to a suicide attempt. And we're not quite sure why, if that's a factor, or if that's more of just the mental set that is happening right now, and that's significant depression. But insomnia is a significant piece to be aware of. And the other part too is that there's a difference between general suicidal ideation, thinking about what if I just killed myself, versus having a plan. Because having a plan crosses that boundary from the theoretical to the actual. If I have a plan, I am seriously considering doing this. More detailed the plan, the more concern too. But if I have a plan, then I know that my level of thinking about suicide has shifted, and that's a very, very significant level of concern. And so it's important, if our children ever disclose suicidal thoughts, or we find out that there's suicidal thoughts going on, it is so important for whatever adult is with them to say, do you have a plan? That's such an important question to ask. And a lot of times we don't think about that, because in that moment we're, so emotionally overwhelmed by this revelation and by this knowledge. But it's so important to ask, do you have a plan? Because that gives us, if the answer is yes, then that gives us really critical information that this is really at a significant level. If there's not a plan, it's still, suicidal thoughts are still something significant to address, of course, but that gives us a gauge of the level of impending need for, and what level of supports might be needed. So I mentioned communication. We have to be direct with our kids. We need to have direct conversations and ask the questions that we want to know. We don't want to beat around the bush. We don't want to be like, oh, so are you doing okay? Yeah, I'm doing okay. Okay, whew, good. That's not enough. If we're concerned about something specific, if we think that there might be self-harm, or if we think that there might be suicidal thoughts, or if we just think, we're thinking our child is anxious or depressed, we need to use the words and we need to ask direct questions about it. You can do it in a very supportive, loving manner. It's not like we have to be all clinical and interviewing and all that kind of stuff. It can be very much a, hey, I noticed that you're not really talking to your friends online anymore. And, I noticed that, you aren't attending class each day like you have been, and that some things have changed and you seem really kind of down. Are you feeling depressed? And then and it's okay to ask direct questions. Sometimes when this happens, I know people sometimes think about killing themselves. Have you had any thoughts about suicide? There is no evidence that asking about suicide directly contributes to suicidal thinking. In fact, it's the opposite. If we use direct questions and we use the word suicide and we ask directly and openly, that develops a rapport and a feeling that you care. And I'm going to be more likely to share with you the truth and to feel supported and to move forward in getting whatever treatment or support that I need. So the direct questioning does not hurt. If anything, it helps the relationship. It might take our children off guard a little bit, but that's because they're not used to it. But by asking direct questions, it shows that we want to know. It shows that we're not afraid to know. A lot of times, our youth do not disclose suicidal thoughts. I believe over half of parents of teenagers who have suicidal thoughts have no idea that they have suicidal thoughts. And that's a scary statistic. But that's because a lot of times our children don't want to tell us, because they know it's going to hurt us. They know it's going to feel sad to us. They know that that's going to have a response, and they don't want to hurt us. But by asking directly and putting it out there, we're communicating, I'm here for you, whatever the answer is. I'm in this for the long haul. So let me just know, because I'm here to support you. We want to be careful when we ask questions or when we're having conversations with our kids, whether it's anxiety, depression, self-harm, suicidal thoughts, whatever it is, that we're trying to avoid judgment of their responses. So, we don't want to communicate to them that their feelings are wrong, that we're disappointed, things like that. What we want to do is provide validation and communication of support. I hear that you're feeling that way. I can understand why you're feeling so sad about things. We want to offer that. We don't want to engage in some of the harmful comments. And if you've said these things, it's okay, because we all say these things sometimes, but we want to be aware that they can be harmful. We want to make sure that we're not negating their experience. We want to make sure that we're not communicating that we're uncomfortable with the conversation. You didn't mean that, right? Whoa, okay. Mom or dad, you can't handle this. No, I didn't mean it. I was just kidding. And that's what we're going to get. Minimizing their feelings. Life can't be that bad. Um, at that moment, it actually is that bad. So yes, it can be. And it can be, my perception is my reality, and how I'm experiencing things is how I'm experiencing them. So we want to make sure that we're not negated that. We want to make sure we're not communicating disappointment, because we don't want to feed into any feelings of being a burden, or being hurtful to us. And my last two examples are things that we do say a lot. I know how you feel. We do not know how anyone else ever feels. We cannot, in the exact same situation, our interpretation and our perception could be completely different. Saying I know how you feel is actually very minimizing, because it's not allowing that individual feel. My feelings are my own and they're unique. You can't understand. We can listen. Um, Sometimes we can offer some related advice, or comments or sharing. There was a time that I was depressed too. It was really hard for me. I can see how that this must be a really hard time for you as well. But again, we're providing validation for their unique experiences. And we don't want to go into the everything will be okay, just put a smile on your face, tomorrow's a brand new day. It doesn't feel that way if you're depressed, if you're anxious. It doesn't feel like everything's going to be okay. Because if it was, then I wouldn't be feeling this way. And we also, it's just really important with our children and our teens to not use that perspective of, in 5 years, this isn't going to matter anymore. In 10 years, you won't even remember this, because our perception of that is validated by our experiences. We know that because we've lived 30, 40, 50 years. They've lived 13. So in even if that's the case, that's like half of my life. Like 5 years is a very long time. And my perception of that happening is not intact. So that means nothing. All that does is minimize what I'm feeling, and express to me that you don't know and you're not listening. So we want to be careful with that. We want to provide validation and support. I hear you. I hear that you're upset, and I'm here for you. We want to avoid, but I hear that you're upset, but is it really that bad? That minimizes what we just said. We just validation, look at and instead of but. I hear that you're so upset, and I'm here for you. And I'm here to help you through this. We want to focus on opportunities for control. And I mentioned that earlier with crisis, is feeling powerless and out of control. We want to provide opportunities for our children to have control across, not just if they're anxious or depressed, across. So giving them opportunities that, I know you have to get your homework done. What's your plan for getting that done today? Control can be in very small pieces. It can be just figuring out my timeline. It can be picking the show that we're going to watch. It doesn't have to be massive things. And it can be within the context of, like, you are expected to do chores and homework today. What's your plan? So we can still provide the boundary and the expectation. It doesn't mean they take over, but we want to provide opportunities for control. One of those things is, especially if our children are very upset, if they're expressing suicidal thoughts, if you're in a new crisis situation, where you've received this information and you're not sure what to do, is just focus on immediate next steps. If they're emotionally overwhelmed over something, things like that, what can we do right now? What can we do just right now? And I always say that as long as it is not illegal or harmful, that whatever their right now step is, allow it, especially if they're a period of extreme emotional distress. And they say, I just want to watch a couple YouTube videos. And we're going, well, we need to deal with this. If that's their right now, if that's their immediate next step, that's fine. That can be what it is. And we can put a boundary to it. Say, okay, well, let's come back together after we watched a couple. But the point is that by moving forward and focusing on immediate next steps, we're now using the thinking part of our brain, the frontal lobe, and not the emotional center of the brain. So the emotion, so we're getting more control, we're getting more logic, we're getting more control over what's happening. And we want that because we don't want that emotional core to be taking over everything. We need to recognize as parents that we are not alone and that we are not expected to have all the answers and do this alone. That we are in crisis as well as our children, and that we need support as well. And that if we just find out, say for example, we find out that our child has suicidal thoughts, now we're in a whole nother crisis on top of crisis. And it's, no one expects you to have the answers, no one expects you to do this alone. Sometimes we expect that of ourselves, but that's not what other people expect. Seek out supports. If your child has ongoing emotional challenges, has depression, you're dealing with anxiety, seek out, I know you're going to find a therapist for your child. I know that you're going to seek out those supports for that child, whatever it is that they need, but find those supports for yourself as well. There is nothing shameful or harmful about going to your own therapy and finding your own therapist. There's nothing wrong with reaching out to the school and saying, this is what's going on and not quite sure what to do. There's nothing wrong with reaching out to other resources, which I have a list of resources here. Other things to do on just a day-to-day basis with our children to help them feel more resilient and help them feel more in control and capable and able to navigate through all these challenges is kind of the last few things that are listed on the slide. Be a role model of authentic emotion and coping. We know that our kids are experiencing emotional challenges right now just with COVID and also just as being youth and going through life. And we want them to share with us what they're experiencing. So let's not act like we're fine. Let's not put on this wall that everything's okay. Oh yeah, I got it under control. And when they go to sleep at night, you're crying, and sobbing and having all these challenges. So we need to model authentic emotion and coping. So if we're feeling anxious and kind of on edge, we can say, I'm feeling really anxious and on edge. I'm worried about this. And that can open up dialogue with your children as well. But it's some valuable modeling to see, like, that's okay. If mom or dad is like that, well, that's okay. That's normal to have feelings like that. And then to model our coping and to show things like, I'm going to go take a walk and clear my head for a little bit, and that might help me feel better. And it's okay if we kind of mess up, and no parent is perfect. I certainly have yelled at my kids at times when they was not warranted. Those things happen, but we also want to be a model of responsibility and owning up to our challenges. So when that happens, it's, what, I yelled at you guys, and it was me. I was so anxious. I'm so frustrated and stressed right now that it came out to you guys, and that was not right. And I apologize for that. And next time I'm feeling that way, this is what I'm going to do instead. Modeling that's what we want our children to do. So we need to model it as well. Encourage family communication, encourage conversations, take these opportunities to, I call them windows of opportunities. I have a 13-year-old son, and he tends to kind of keep to himself a lot of times, right? Or he wants to be on Xbox, but there's certain windows that pop up. Like the Cardinals football game is on, and he's just a chatterbox. And at that moment, I say, laptop closed. This is my opportunity. This is my window. I'm going to go watch the game with him and let him go. And so we want to find those opportunities that our children are giving us and put the work aside, put the other piece aside, and take those opportunities. And we want to encourage communication. One activity that I like to do is the highs and lows, where when everyone's sitting down together for a meal, whether or not that happens on a regular daily basis or not, but everyone's sitting down together and everyone just goes around and says their high and their low of the day, the high point and the low point, and we all have them. And it might not be that big of a deal. It might be like, my low was I stepped in gum, and my high was I got my math homework done. Or it could be more significant. But the idea there is that every person around that table is sharing that, and there's no judgment in it. It's just, okay. And if we want to follow up later, we can do that. But everyone shares because that's a normal part of our life and our existence, is having that. And then talking openly about events. Children ask the questions they need to know. Listen to their questions. When they ask something about, like my daughter asked about, are people going to riot? Why are people going to riot? Listening to their questions and providing them with answers to their questions. We don't need to go on and on and on. They're going to ask the questions that they need to know. We need to listen to that because that's going to be most beneficial to them. And it's okay to talk to them about stuff that's going on. But we also want to make sure when we're doing that, that we're emphasizing, if we're looking, especially these larger pieces, COVID, riots, the election, all these other pieces that have happened and are happening, that we also bring it down and say, so here we are right now, and we're in our house and we are safe. And we want to encourage those feelings of safety in our children, especially when they're asking those difficult questions, that you are safe right now. In this moment, in this specific moment, each one of us, every one of us is safe. Because if we weren't, we wouldn't be on here right now. We'd be reacting, we'd be responding. Now, anxiety makes us think forward and like, yeah, but this could happen, but it's not happening now. We're safe right now. And we want to encourage our children to recognize that in themselves as well. I am safe, even when the news is crazy, even when I'm hearing things all over. And of course, we're hearing all kinds of different variations of facts, and we don't know what's true and what's not, especially with our kids. They're not sure what to decipher and how. They can still come back to, I'm safe. And then the other piece is just encouraging those boundaries. Again, especially if we're home for everything. As adults, we need to set our boundaries. I'm done working at 5 o'clock. The end of the school day is this time. And having boundaries and not letting everything melt into each other. I do encourage too that our children who are online, that their online learning space is not their bed, is not ideally not even in their bedroom, because their bedroom is a place of relaxation and comfort and coping and calm. And to add the school environment, that's not fair. They don't go to school traditionally in their bedroom. So having separate places, separate areas, and for us, if we're working from home as well, having a separate, distinct place. This is where my workspace is. The rest of my space is still my home space. So I included some resources on here. Crisis hotlines are a really important thing. I encourage people to have these in their phones. Because crisis hotlines is something you can call 24/7, and they will dispatch a crisis team, a trained crisis team, to your home or wherever your location is, to provide further assessment and support in figuring out what to do next. So this is often something that is used if we're worried about suicide, if there's significant self-harm, if the emotional piece is so extreme that it can't be managed and we don't know what's going to happen next. Challenge with crisis teams is, well, not the challenge. They are 24/7, free, no insurance needed or anything like that. Challenge of that is that they're also in high demand. And sometimes we end up having a 2 to 3 hour wait before they make it to our door. And that can be a very challenging period of time. And you can also see things get better during that time. But even if that's the case, having them come to provide that support is still a very beneficial piece. So it's good to know that. Teen Lifeline, of course, is a great resource. It can be texted or called. Parents can call it as well. Same thing with the National Suicide Prevention Lifeline, which will be coming. There will actually be coming a 3-digit phone number for suicide prevention in 2022, I believe. It was just approved, like a 911 number for suicide. I can't remember what it is, but that's going to be an exciting thing. So we don't have to remember all these lifeline numbers. We can just contact that directly. But the National Suicide Prevention Lifeline is another important one. You can text home to 741-741 with any sort of crisis, and you will get a response to help you try to find support in whatever it is that you need. And I also encourage people to consider contacting their police department. There are certain police departments, and even in advance, call your police department and find out what they're doing for mental health supports. A lot of police departments are working very closely to make sure people know how to respond to a mental health situation. And so then if you call 911 or your police department non-emergency line, it'll probably be an emergency though, and call them and say, we need someone out here. It's my 13-year-old is talking about suicide and I need someone who can help me figure that out. Then they will dispatch the people who are trained to do that. But some police departments are working really hard to get everyone to that level so that it's not always a mental health situation is not being responded to as criminal activity. So there's a lot of positives going on in there. I also just want to mention a couple other things that maybe we don't think of necessarily right away, but there's some other resources. The Virtual Hope app is a great app. It's designed for adolescents. With it kind of is designed to kind of target depression. It's great for depression, anxiety, just in general coping. It's a great app. It has like some distraction games on it. It has uh, meditations and guidance on muscle relaxation on it. It has a way for kids to come up with their own coping plan. It has inspirational quotes. It has this kind of just, it's this nice compilation of coping, and it was developed to be free. So there's no like, you can listen to this meditation if you pay $3. You know, like there's none of that. Is designed to be a free app for our youth. TeenStrongAZ.com is a fantastic website that was founded by someone locally by Sherry Eklund in the community, who just wanted to provide a free, supportive website. It's geared towards teenage girls. And there's great articles and resources and blogs and ways to connect with support. It's just a great website. I refer my clients there a lot. Like, just go read through. It helps that sense of I'm not alone. There's other people, and we can find some guidance and how to handle it. Preparedparentingaz.org is mine. And that's my basically nonprofit community outreach effort that I have. And I was scheduling regular in-person sessions and symposiums for parents. And of course, those are out by the wayside right now. But right now I'm hosting a series of community events, community discussions, sorry, I should say, online Zoom community discussions. I've had a couple related to suicide prevention. I have one related to anxiety. December 1st is the next one. It's all about coping with loss being a very broad concept right now with the pandemic, and talking about what that looks like is just casual Zoom community discussions to help spread awareness and knowledge and have those conversations. So, and there you see my contact information as well. So now would be a great time for any questions.
I imagine that EMDR would be a great resource for adolescents and adults to be utilizing during this time.
I know that some people have found EMDR to be a really helpful addition to traditional therapy. A lot of times it's a great combination, and I know I've referred some of my clients to that. It's interesting because EMDR is especially helpful with specific trauma events. And COVID being more of a general, like we're all kind of still in crisis, and you know, but what we're finding is that anytime we experience a crisis, the crises and traumas of our past become more elevated. And so we see in our youth and as adults that we're being triggered, and that we're, re-experiencing things that we've lost in the past, and things that we've, traumas that we've had in the past. So I think that definitely the referrals and the need for EMDR have increased. Yeah.
Sure. And I imagine that this is going to instill fear in a lot of us, whether it's youth and adults. When this kind of subsides and we're back to quote unquote normal, are we going to shake hands? Are we going to feel comfortable hugging each other? Are we going to feel comfortable being in that space? What can we do with our adolescents and our youth to help them not have this fear kind of mentality of being with their peers once this is not as a big of a concern?
Yeah, that's a really good question. And I've already had some of my clients who have said, when we go back, I'm going to be a mess, and I don't know if you've noticed it yourself. Like, I go to a store or something, I'm talking to the cashier and I'm like, I don't feel like I'm even communicating well anymore. Like, I'm not used to having these conversations. And so I think the thing there is that the fear is going to be, we need to validate, we need to expect it. We're going to have fears, and that's okay. And to not treat it as an abnormality, but as a collective experience that, yeah, we're all dealing with this. And what are and figuring out what our boundaries are, and finding that area of control, that, yeah, people are shaking hands, but I'm not ready for that yet. And that's okay. So how that can be your boundary, but how are you going to communicate that boundary? And how are you going to make sure that, other people understand that that's where you're coming from? It shouldn't be something like that should not break your relationships, and to help them kind of understand healthy expectations and so on. But I think it's important to recognize that is to be expected. And again, just giving opportunities for control and validation and support.
Right. Yeah, I hear you on that. I think having grace and not judging where other people are, and
Mhm.
in this situation is very important to know now and know for the future. Anybody else want to ask a question before we wrap up? Okay, then. Well, Dr. McCall, this was such an informative presentation and a very timely conversation. So thank you so much for being with us today and presenting to our
Thank you for
community.
having me.
Of course, our pleasure. If you have any questions or want to be a part of her prepared parenting group, please go ahead and reach out to Dr. McCall. And just so you all know, we will not be hosting any more webinars this year as the holidays are approaching. However, we will restart those in the new year. So our next community education event will be on Tuesday, January 26th at 6 p.m. And Mary Hager of Hager College Consulting will be presenting on what matters in college admissions. We hope to see you there. Thank you for everyone being a part of this presentation today. Take care and happy holidays to you and your family.
Thank you.
Bye.